Sorry, I was muted. Uh, Hi all, my name is Becky Reitzes. I work for Public Health Seattle King County. I am a lead trainer and educator with King County and have been with them since 2001. And I have been working on the COVID pandemic since the beginning of the pandemic, since March 1st. So I'm happy to answer any questions today. Today I was asked specifically to talk about the vaccine, but I'm happy to answer any questions that folks have about COVID as we go. And please feel free to go ahead and put them in the chat. Peggy, I have a question for you. Are you gonna hold the questions till the end, or do you want to ask them as we go? I'm fine either. I'm fine either way.
Yeah, let's have the question till the very end, but feel free to type in your questions in the chat box and we will monitor those.
That sounds great. And then one other thing, Peggy, if there is a clarification question about something I just said that comes up that seems important, let me know, because I want to make sure that I'm not being confusing.
Sounds good.
Then, great, thank you. And then because it is being recorded, again, go ahead and put your questions in the chat, and that way your questions are being recorded. So today I wanted to chat about the vaccine, and one of the things I'm going to do today is I'm going to do things kind of twofold. I know that some folks are on this call as somebody in community who wants information about the vaccine. I know some folks are on the call who work in community, either as a trainer, an advocate, a speaker, a faith-based leader, and will be sharing information with your community. So I want to make sure that folks have enough information, both for themselves, but also to be able to share with community. So that's my goal for today. And Peggy, you can still see my screen, correct? I'm assuming so.
Yes.
Okay, great. So we're going to do sort of an intro to the vaccine training itself. And basically what we've done at Public Health is created some materials that you can actually use in community, like this actual PowerPoint we're about to do. And it's also in currently 15 languages and soon to be probably about 20. So, and I'm happy to give them to folks. So I want to actually, sort of do a little intro to that. And then we're actually going to do the training itself and talk about ways that you can present this information in community. So what we're not doing today, and sometimes when you talk about a training of trainers or training of educators, people think of hey, we're going to talk about teaching skills or training skills. We're going to talk about class management of folks online. So we're not doing any of that today. And then we're also not, I'm starting here in the pandemic at the vaccine. And so I'm not starting at the basic, sort of the general facts and the 101s. And again, if there are questions about that, I'm happy to answer them once we get to the Q&A portion, because I think they are so important for folks to understand. So today we're going to be using a PowerPoint. We created this PowerPoint. We have it in many languages. All of the speaker notes and the trainer notes in there are also translated. And I'm happy to send them out, and I will give them to folks. But I want to be really clear. I don't expect folks to go out in community and use PowerPoints. I'm often asked for PowerPoints, so this is helpful for us and me as a trainer. Sometimes they're helpful as just a kicking off point. Sometimes I literally get 3 slides in and then get a million questions, and then we just go with the questions, and that's it. So my hope is today that you'll get this information today in the presentation. I can send you all the PowerPoints. We can send you all the information. You can use that to present in community. You can use that to make a social media post. You can use that to have a conversation with a neighbor. You can use that in your congregation. So however it is that you use this information, the goal for us at Public Health is really to get this information out as far and wide as possible. So the PowerPoint is really just a guide for us to have this conversation today, and for me to make sure you get all your questions answered, and then we're going to open it up live for more questions as well. So I'm going to cue the PowerPoint. Again, I mentioned today we're going to specifically talk about the vaccine and vaccination for COVID-19. I really want to start with an acknowledgement and use this opportunity to discuss the fact that there's a lot of distrust out there around the vaccine. I also want to acknowledge, you might hear my dog eating in the background, so sorry about that. COVID life is real fun. So I want to acknowledge that there's a lot of distrust about the vaccine, and you know, there's been a lot of talk about how we need to build trust with community. And I don't see it that way, and we don't see it that way at Public Health. What we think about more is about building our own trustworthiness. People have really, really valid reasons to distrust government, to distrust many medical communities, mainly because of historical and current trauma and oppression that many communities have faced at the hands of the U.S. government and at medical and by medical institutions. And this trauma and ongoing injustices has happened on U.S. soil and also by U.S. on other soil. And so, you know, when we are talking to folks in community, working with community, I think it's really important for us to understand where this distrust is coming from, and that it's valid, it's rational. People have extremely logical reasons for this mistrust. And, you know, my hope in presenting this information is that I can help build some of the trustworthiness of our institution and of the vaccine. I'm certainly not here to convince anyone to take a vaccine. That's not my role. That's not what I feel like anyone's role is. Really, what I'm here to do and to help with is to provide accurate information and help people make informed decisions on whether or not they want to get a vaccine, and specifically whether or not they want to get this vaccine. There's also a lot of distrust around the vaccine based on the political climate, the very chaotic political climate that we have been a part of for the past 4 years, and a lot of the mixed messages that have come out federally and throughout the country about the vaccine and about how it's manufactured and how it's going to be rolled out. There's also a lot of distrust around how quickly the vaccine came out, so we're going to talk about that today. And there's really been a widespread misinformation campaign about the vaccine, and some of that has been on purpose, and some of that is just widespread misinformation happening and confusion about the vaccine. So definitely want to address some of that today, and again, continuing to acknowledge that all of this has lent itself to this deep distrust and concerns about the vaccine. So I want to talk about why the vaccine is trustworthy. You know, one of the things I want to make sure to say is that as somebody who works for King County and someone who's been living in the same political climate and of chaos that everybody else has been as well, you know, I was somebody who was deeply skeptical about the vaccine and how quickly a vaccine could get rolled out. And one of the reasons I'm excited to be able to do this work is that I've gotten to read the research and to learn a lot about the vaccine and talk to some of the folks who actually were part of the development of the vaccine here at Fred Hutch, and really come to an understanding and trustworthiness of the vaccine. So I do like to be able to share some information about it so folks can again come to their own conclusions about it. So some of the benefits of the COVID-19 vaccine, people are often like, well, why would I get this thing? And so I want to start by saying it's highly effective in preventing illness, hospitalization, and death from COVID-19 after 2 doses. So to be really clear, we have 2 vaccines that have been approved here in the US. Both of these vaccines, we're going to talk about the type of vaccine they are in a minute, but both of the vaccines are 2 doses. One is 3 weeks apart and one is 4 weeks apart. And once folks receive both doses, it is highly effective. And, you know, when the vaccine was like starting to be developed, we were thinking maybe it'd be like 50% effective and like at best, maybe 70%. And actually the 2 vaccines that are approved here in the US are about 95% effective, which was sort of astounding to us. And just to put that into perspective, because we don't always talk about how effective vaccines are, you know, that's not a normal conversation we have every day all the time. You know, the flu vaccine that we get every year is about 60% effective. So having a vaccine that's 95% effective at protecting us against, COVID-19 illness, hospitalization, and death is a really, really highly effective vaccine. The other thing we know about the vaccine is they did a really great job of being inclusive of the volunteers in the studies. And to be clear, they started with a very, very small group of volunteers. And as the researchers learned how, that it was safe and effective, that number continued to grow to like tens and hundreds of thousands of folks. But they did a really great job at making sure they had a diverse range of folks in the study. And so we had diverse racial groups in the study. We had folks who were 65 years and older in the studies. We've had folks who were different sizes and weights. And then we also had folks who had different health conditions, including things like diabetes, hypertension, heart and lung disease. And the importance of all of these things is that we know that these two vaccines are effective across all of these groups of folks. So that was really important. And not always typical that vaccines are that inclusive. So it was great that these two studies and these two vaccines made a point to do that. There's been a lot of questions about what is an mRNA vaccine. The vaccine works, when I describe it to you, it's going to sound very familiar because the way that it works in our body is very similar to other vaccines. But the mRNA or messenger RNA vaccine is a little bit of a different technology than we're used to. So both the vaccines that we have approved here in the US are both messenger RNA vaccines. And what they do is the messenger RNA is a molecule, and then it gets injected, as a vaccine into our body. And that molecule actually creates a protein that looks exactly like the one that's found on the surface of the COVID-19 virus. So if you see the picture of the COVID-19 that I have, this little drawing in the corner, it shows that there's spikes on the virus, and the messenger RNA vaccine creates spikes to mimic the COVID virus. And that way, our body, our body recognizes that as not something that's supposed to be in our body and creates antibodies to fight it. And so our body learns to actually identify that protein without ever having to get COVID-19 in our body. And it starts producing these antibodies immediately. So the way it works in our body is very similar to like what we're used to around vaccines, in that, we create antibodies that are developed to fight off COVID-19. The unique part is that this vaccine doesn't actually have any of that virus in it. And then again, this vaccine is going to prevent illness, hospitalization, and death. I'm trying to think if there's one more thing I wanted to say about that. So I get a lot of questions about side effects. And, we sort of struggle with the term side effects because I think our culture thinks of these as side effects, but really these are just like the things that we expect to happen after getting a vaccine. So our body gets this response of antibodies, and we can feel that. We have effects on the body based on that. And so what some of these effects are some of the things you can expect after getting the vaccine. There's a range of things to expect. The most common ones we hear about are sore arm, fatigue, headache, and a mild fever. I want to be clear, some people get all of the side effects, some people get none of the side effects. I have neighbors who are both healthcare providers and a couple, and one of them had none and one of them had all. So it really depends on the person. And some people get them kind of mildly, so mild fever, mild headache. And I've also talked to folks who've had a little bit of higher fever and migraine. The nice thing to know is that usually the side effects are going to show up in the first few days. So usually like that day or the next day is when they show up, but it can be in that first week. And then usually they're going to last only a day or two. And part of the thing for us to keep in mind and also to like share with other folks is really these effects on the body is really actually just telling us our immune system is working. And oftentimes people will get maybe more side effects on the second shot. And the reason for that is the first shot, you're about 50% protected against serious illness and death from COVID-19. the second shot, you have even more antibodies being created, and you're about 95% protected. And so that's why people are getting a little bit more response happen after the second shot. I put on here some information, and again, I know that not everybody can see my slides, so that's why I am making sure to sort of cover everything on them out loud as well. So I made sure to put a piece on here about the allergic reactions, because a lot of folks have been hearing in the news about these allergic reactions that were happening around Pfizer vaccine. So I want to be really clear. One, again, often when it makes the news, it's usually the more fantastical things that are going to make the news. But the severe allergic reactions really are very rare. About a month ago, the last number, well, these are still the numbers I'm hearing in terms of how many people have had this response. I don't know exactly how many vaccines have been given to date. At the time, it was like 1.9 million doses of Pfizer vaccine and only 21 allergic reactions. So to be really clear, they're very rare reactions. We didn't have any deaths as a result of their reactions. And if somebody has ever had any type of very severe reaction, so trouble breathing, weakened heartbeat, severe vomiting, so something that's going to be more life-threatening or like threatening of like a hospitalization, that's when you want to make sure to talk to your healthcare provider about it. It doesn't prevent them from getting the vaccine. Basically, what needs to happen is they need to be monitored for about 15 minutes and make sure they're okay. The other thing I would say is if you've had such a severe reaction that you actually have an EpiPen, you'd want to go ahead and bring it with you, and that way you have it just in case. So I'm going to move into common questions. So one of the biggest questions I get is, can the vaccine cause me to get sick, or will it give me COVID? And so the answer is no. The vaccine cannot cause COVID-19 infection. And again, there's no virus in the vaccine. I think one of the things that happens is people get the vaccine and then they get those side effects that are symptoms that are similar to what, the symptoms we talk about with the COVID infection. And then they think, oh, well, they were just given COVID. Someone just gave them COVID in that vaccine. And that's not what's happening. So again, that's our immune system response to the vaccine and in the creation of the antibodies. So no, this vaccine can't make someone sick or give them COVID. And people should expect to have those symptoms as a result of getting the vaccine. So again, those side effects. Another question I get a lot about was, how was the COVID vaccine developed so quickly? In the beginning, we were talking about how the vaccine was not going to come out for at least 18 months, and that's the typical time frame that vaccines happen. And then here we are a year in, and we have a vaccine. So it's super important for folks to know that there were no safety steps that were skipped in creating the vaccine. Some of the ways it was able to be developed quickly is, one, we were in a pandemic, and so there was a lot of money that was put towards the vaccine. So with that money, they were able to create more laboratories, have more volunteers, have places for folks to go. So that the financial piece was super helpful in order to move this quickly. Another piece that was where I was able to move a little quicker is that the messenger RNA vaccine was a little bit quicker to develop, which is why Moderna and Pfizer chose those two to work on. I'm assuming that's why they chose those two to work on, because they were a little bit quicker vaccines to develop, because they don't have to cultivate virus cultures in a lab, because again, there's no virus in the vaccine. And then the other thing to say is that because we're in a pandemic, usually folks go sequential, like you do step 1, step 2, step 3, step 4. And in this situation, what happened was, where once the companies found that the research showed that the vaccines that they were producing were safe, and that they were getting really good results about effectiveness from the vaccine, then what they started to do was actually continue the testing. And again, no pieces were skipped in the testing. And at the same time, they began production of the vaccine. So they began producing millions of doses of the vaccine. At the same time, they were continuing to test the vaccine. This isn't usually done, mainly because if the vaccine is shown not to be effective, then those doses have to be destroyed. So it's not a typical way of doing it, but because we're in a pandemic and people were dying, then it became necessary to make this out in the world quicker. So the testing was happening at the same time as the production, and once it was found to be safe and effective, then these two were approved and already had doses created that could be sent out into our communities. You know, the thing I did remember that I wanted to say about the mRNA vaccine is I mentioned it was a new technology, and I want to be really clear, it's a new technology for a vaccine. And specifically for this COVID vaccine, but the mRNA technology is not new technology. It's technology that we've had and been studying for 30 years, and it's been used for other illnesses like cancer. So I just want to be really clear, because we get a lot of questions about, you know, does the messenger RNA vaccine change your DNA? And the answer is no. Well, and then the next question is, well, how do you know if it's new? So I just want to be really clear, it's not a new technology. And it is new that we're using it for this vaccine, but we've been able to study it in bodies for the past 3 decades. So sorry, that was the piece I was trying to remember earlier. And then what are the ingredients in the vaccine? So the vaccines, the Pfizer vaccine and the Moderna vaccines are almost identical. They're very similar vaccines. The active ingredient is that messenger RNA, which is the molecule that the body makes to teach the infection-fighting cells or antibodies how to protect against coronavirus. There's also specific fats, and they're specifically synthetic fats. So I want to be really clear, there's no animal product, and I especially want to mention there's no pork, because there's definitely folks for religious beliefs can't eat pork or can't eat certain animals. And so there are actually no animals or animal fats in this vaccine. It's specifically synthetic fats or lipids that were made. And the reason they're in there is they actually form a protective bubble around the messenger RNA to like protect it when it goes into the body. And then there's also some salts and sugars in there. The sugar is important because it keeps it from clumping, keeps the vaccine from clumping when it's being stored. And then the salt is really important because it helps our body not reject the vaccine. It kind of mimics like the natural chemistry of the body, because if you think about our bodies are mainly salt and water. So it kind of mimics that natural chemistry so that our bodies don't reject the vaccine. To be clear, I've definitely had some folks ask me, like, I have high blood pressure or I have diabetes and there's salt and there's sugar in these. Is it safe for me to take? And the answer is yes. I mean, this was studied on, these vaccines were studied with folks who have diabetes and have high blood pressure, but also it's a very minor amount that are in them. So with that, I also get the question a lot, is there a microchip in the vaccine? And the answer is no. And then, you know, the next question is, well, again, how do you know? And so the way we know is when we have a list of all the ingredients that are in them, but I also want to make sure to say that each of these vaccines has undergone multiple independent reviews as well. So it's not just Moderna said this and Pfizer said this. It's also all of the independent research that has gone into the vaccine as well, and making sure that the vaccine is safe, going over all the ingredients that are in the vaccine, making sure everything coming out of the vaccine has been honest and transparent, including actually here in Washington State and many other states. Before the vaccine was allowed to be distributed in many states, the local and state health departments actually also did independent reviews of all the research. Another question I get a lot is there fetal tissue in the vaccine? And for some folks, for moral issues or religious issues, they would not use the vaccine if it did have fetal tissue. And Peggy, I think you had a question.
Yes, we have a clarifying question asking about this is applied to both Pfizer and Moderna. Yes,
absolutely. And again, the Pfizer and Moderna vaccines are really, really similar, but they both have these ingredients in them. So the difference between the two is they have a little bit different synthetic fats, but again, they're all synthetic. So yeah, and this applies to both the Pfizer and Moderna. Folks may also be hearing about the Johnson & Johnson one and the AstraZeneca. one, and those are, one, they're not approved yet in the US, so I haven't really been talking about them because they're not approved yet here, but also those are more of the traditional type of vaccine that folks are used to, that do use some of the virus to create antibodies in the body. So again, they're a little bit of a different vaccine, and they've been shown to have a little bit of a different success rate in terms of like how effective they are. But yeah, everything I'm talking about applies to both. And then in terms of the fetal tissue, I also wanted to mention that, you know, so this vaccine and the messenger RNA vaccine, there was no fetal tissue testing, but we do know that, you know, in the past 3 decades, there was some fetal tissue used in development of the technology, but has not been currently used in this development of the vaccine. And the Pope actually has come out and given his blessing around the vaccine, and has, you know, he has a whole statement around his blessing around this vaccine. So I do want to mention that because I've gotten a lot of questions from folks about it. And then again, I want to make sure to say that there's no egg. So for folks who have an egg allergy and have had reactions to vaccines in the past because of eggs, there's no egg, there's no pork, and there's no other animal products in the vaccine. So some other questions are, you know, that I get a lot about is like, can children get it? Can folks who are pregnant or lactating get it? So I want to be really clear right now. Again, there's 2 vaccines. One is approved for folks 18 and older, and one is approved for folks 16 and older. So children under the age of 16 cannot currently get the vaccine. It is being studied though. So what they did was they started with the vaccine for 16 and up and the other one 18 and up. They wanted to make sure it was safe and effective. Once it was found to be safe and effective, then they started now sort of lowering the age, and that's going to be going in phases. So currently they're looking at young people ages 12 to 16. And then if it is found to be safe and effective with young people 12 to 16, then they'll again go younger. So right now, the only folks who can get the vaccine are 16 and older. In terms of folks who are pregnant or lactating, again, I want to be really clear that they did not include folks in the study who were pregnant or lactating. And with that, it is approved for people who are pregnant or chest feeding or breastfeeding. So if somebody is pregnant and breastfeeding or chest feeding and they want to get the vaccine, it is approved for folks to get that. And we don't have any, you know, again, people have been getting it and we have not heard of any negative. Since it's been approved, folks have been getting it. We haven't heard anything negative around, you know, the pregnancy or around lactation. But I do like to let people know that folks who are pregnant and lactating were not included in the study so that they can make their own informed decision about if they want to get the vaccine or not. We have no reason to think that the technology and the vaccine would not be safe. And again, there's no COVID actually in the vaccine itself. So we're not concerned about the lactation or the milk. And then can you get vaccinated if you've already had COVID-19? And the answer is yes. If someone's had COVID-19 in the last 3 months and possibly even the last 6 months, what we know is they may have some stronger side effects because they already have some of the antibodies probably still in their body. So they may actually have some stronger side effects from the vaccine. And yes, they can get vaccinated. And if it's been more than 6 months, I would absolutely, you know, we would recommend that folks would get vaccinated because they may no longer have, let me back up. There's some thought that if someone has COVID-19, like naturally occurring in the world, like they got COVID-19 from someone else and they had the infection, that after they get better, that they may have some immunity to getting it again for the first either 3 months or 6 months. We're still studying that. And that said, we have seen people get COVID again in the first 3 months. So there may be some immunity, but we're not sure how much. So absolutely folks can get the vaccine. And if it's been more than 3 months and they're able to get the vaccine, and they want it, then it would be a great idea to get it. And then there are definitely things we're still learning about the vaccine. So there's a lot of things we know. And so I like to make sure to say, you know, there's a lot we know and there's a lot we're still learning. And one of the things we're still learning is how long will the immunity last? So some folks want to know, is this something I'm going to have to get every year? Is this something like the flu vaccine, or is this something I get once and I'm done? And that's a piece we're still learning because the vaccine is new. So all of the folks who've been in the studies have agreed to also be followed up on. And so that's where a lot of the research is still continuing, and we're learning how long the immunity will last. And the same is true actually from natural occurring COVID infections too. That's something we're still learning, is how long these antibodies will actually stay in the body and enough to protect us from getting sick with COVID. And then another thing we're still learning is will getting vaccinated prevent someone from actually spreading COVID? So we know that if someone gets vaccinated with either the Pfizer or the Moderna vaccine, they are 95% protected at getting sick with COVID-19, hospitalized, and dying. What we're still learning is, will it stop someone from getting the infection? Will it stop someone from being able to prevent passing it? And these are things we're still learning. Our hunch is probably it's a vaccine, and we know vaccines really do help prevent passing viruses. But it's not something we can say for sure, because it's definitely a piece that we're still learning. And basically, when they were doing the studies, they were studying the people who were getting vaccinated, but they weren't studying all the people around them to see, they were getting COVID from the folks who were getting vaccinated or not. So now those studies are happening as well. So that's currently being researched. I do see a question in the chat about why are children not vaccinated. It's because they haven't researched it yet on children. So children were not included in either the Pfizer or Moderna vaccine. So only folks 16 and up were included. And so they want to continue testing it on younger ages before approving it for folks under 16. So how can I get vaccinated? This is definitely the question of the century. And, there's a lot of frustration about not being able to get vaccinated. And I share that frustration. And unfortunately, we don't have enough vaccine to meet the demand. Honestly, our previous federal government turned down $1.9 billion worth of the vaccine. So we had a limited, for the US, so we had a limited amount of vaccine in our country. And then we were promised a certain amount here in Washington State. And right before we received it, we were told we're getting 40% less than that. So we really have a limited amount, which is why it's been really frustrating for folks to get. It's why there's tiers and why people are being prioritized. And so unfortunately, that's not the way that we want it to go. And it's going that way because of this limited supply. So as the current administration announced that they are buying 200 million doses of the vaccine, so that has to be produced and then distributed. And once we get that, and once we start getting more doses, the folks will be able to get vaccinated quicker. There'll be, less wait time for the vaccine, and it'll just be more available. So we know eventually everyone who wants to get the vaccine will be able to get it. The big question is when. And again, we're going to hope to get more in March and April and continue to get more available. But our best guess is it'll be summertime before the majority of folks who want to be vaccinated will be able to get vaccinated. And again, that's just about the limited number of doses that we can get. And then again, how can someone get vaccinated? So I want to make sure to say that folks, you can call if you have a healthcare provider, you can call your doctor's office or your healthcare provider and see if they have the vaccine available. You can also call your pharmacy. So the federal government was also allocating some to pharmacies as well. So some pharmacies may have the vaccine as well. There's also a website, findyourphase.wa.org. And this website currently is in English and Spanish. So I want to make sure to say that. And so if folks are able to read and be able to use technology in English and Spanish, you can go to this website, you can find out, you can type in your information, you can find out when you're eligible for the vaccine, and then they'll also notify you when you are eligible. for folks who would rather make a phone call or for folks who speak languages other than English and Spanish, I'm going to read the number out loud because, again, I'm not going to assume everybody can see my slides. But the number is 1-800-525-0127. So folks can call that number to also find out when they'll be eligible and how to make an appointment. If folks need a language other than English, you would press the pound key and then state the language you need. So Mandarin, so you can just state the language you need, and that one, and that line will get you an interpreter for sure. And then I did want to, I know this is a little off the topic about the vaccine, but I'm getting so many questions about the variant strains that I really wanted to just take a minute and mention it. So I'm sure a lot of folks have been hearing about these new strains of COVID that are happening across the world. So a main thing to say is that we were expecting this. So all viruses mutate. We assumed that this virus would mutate. Unfortunately, one of the reasons we weren't hearing more about it in the U.S. is the previous federal administration was not funding a lot of testing of the strains. So like the UK and South Africa, we're finding additional strains quicker than we were because like the UK was one of the leaders in doing a lot of the testing of the strains to see what the new strains were in their country. And the big thing about these strains is that, they're still COVID. So they pass the same way. They're going to be spread the same way. The only differences are actually more contagious. So what that means is they can spread quicker, and one person can spread them to more people than the previous strains. So they're not different than the other COVID we know, except that they are better at spreading. We do know that we have identified one of these strains that is quicker at spreading, so B117 here in King County. And again, the big thing to know about it is it's just going to spread more. I'm not going to say just, it's going to spread more easily. And so we need to be even more diligent about prevention. So we don't have any reason to think that the two vaccines we have here in the US would not work against these strains. I'm going to say that differently. We believe that the vaccines will work against these strains. It's something we are still learning, but because these strains are still COVID, and the mRNA vaccine trains our body to recognize COVID, we do believe that they will still be effective. And with these new strains and the fact that they spread quicker and easier, we do really recommend that folks, again, continue to wear face coverings and continue to wash hands and not touch your face. And the big thing to know about the vaccine is it's going to be a huge help in ending the pandemic, but it can't do it alone. So especially right now, while we're still continuing to roll out the vaccine, we need to still be extremely diligent, and now with the new strains, even more diligent about wearing masks and face coverings when we're around people we don't already live with, limiting activities both in the home with folks who don't live with us and also outside the home, wash our hands, clean surfaces that are like high-touch surfaces often to sterilize and clean, practice social distancing, not touch our faces. So super, super important to continue to do all of these things. Folks may have heard also about the double masking that has been, been talked about all over the place. So I want to be really clear. We do know that wearing face covering and masks work. I know there was confusion in the beginning about that, and some folks, didn't really end up trusting a lot of things that public health was saying because we switched our message. And so to be really clear, COVID was new. We were all learning about it. We've learned a lot about it. We've learned a lot about how to prevent it. So we know that masks and face coverings are one of the things that will help prevent it. And now we know that there's new strains that pass even easier. So that's where the messaging around double mask or double face coverings comes in, is that if these ones are more contagious, it is great to have even better prevention. So with that, I'm just going to show you a couple of resources. I'm going to ask Peggy to talk about her resources, and then we're going to open it up. For questions. I do want folks to know that the public health website has information about COVID-19 for individuals, for schools and childcare, for small businesses. So we have a whole schools and childcare reopening toolkit. We have a whole toolkit for businesses that they literally can download some best practices and fill in for their businesses. But we did a lot of the work for folks because small businesses are struggling so hard to even stay open, let alone write these new instructions for their employees. We also have all the latest updates and guidance that's coming down through the state. We make sure to keep on our website. And then all of this information is available in 34 languages on our website. And then we also have a website specifically about the COVID-19 vaccine. And currently that one is available in 18 languages. And as I mentioned, this PowerPoint is currently in 15 and soon to be 20, I believe, because every time I get a request for a new language, I get it. I send it up to our language access team and ask them to translate it for us. And then I'm gonna hand this over to either Joaquin or Peggy and see if you wanted to talk about Seattle vaccine outreach.
Becky, I will hand it over to Joaquin.
Oh, sorry. For some reason, my video is disabled. Or should I not?
Let me fix that.
In any case, hi everyone. This is Joaquin Wee, and I am the External Affairs and Policy Manager for the City of Seattle Office of Immigrant and Refugee Affairs. Thanks for having me today. As Becky mentioned, right now vaccine supply is severely low, and it's going to continue to be low for the foreseeable future. The City of Seattle has an allotment of 1,000 vaccines per week, which is not a lot. And even then, we sometimes do not get our full allotment of 1,000 vaccines, there I am, because of supply issues. So for instance, this week we were supposed to get 1,000. We only received about half of that. So because vaccine supply is both low and also because it is, also just wanted to direct people to the slideshow. I'm speaking a little bit about this. Because the vaccine supply is low, and because vaccine supply is uncertain, it has been very challenging for the city to launch community vaccine events. What we've been doing is we've been working with community-based organizations who we know have access to eligible elders in the community who've had difficulty signing up for vaccines. And many of these organizations are ones that serve immigrant and refugee communities, especially communities that have been hit hardest by the COVID-19 pandemic, specifically Black and African immigrants, Latinx communities, and Native Hawaiian and Pacific Islander communities, where the disparities are the largest. And these are also communities that primarily live and work in South Seattle and South King County. So we reach out to organizations who we know have relationships with elders in the community, folks who are 65 years of age or older, or folks who are 50 years of age and older who live in multi-generational households. And we say to them, okay, we have the Seattle Fire Department mobile vaccination team, and these folks have access to a certain supply of vaccines per week. And they also can set up tents and tables and set up a space where people can get vaccinated either outside or in an enclosed space that's well ventilated. And then we just need you to help fill out appointments and time slots to ensure that the communities that you want to serve are able to cycle through in 15 or half-hour intervals. So one example of one of the first vaccine events that we did was with the Ethiopian community in Seattle. We did a clinic with them earlier this month, Friday, February 5th, and they had already done a pop-up clinic with Swedish, and they were able to vaccinate over 150 people, but they had over 100 people on their waiting list. And these were folks who were East African, primarily Somali, Eritrean, and Ethiopian Americans. So we said, well, if you already have a waiting list and we have vaccine, maybe we can come and set up a clinic at your place. And so we did a walkthrough, the Seattle Fire Department came, and we vaccinated over 215 eligible East African individuals. So we're using that same pilot, that same partnership with other organizations around Seattle. The problem is that we are now running into extreme vaccine supply limitations. So we're no longer able to organize small vaccine clinics in parking lots or in buildings. Instead, what we're trying to do is we're trying to consolidate vaccine supply for one event in a neighborhood, like in West Seattle or Rainier Beach, et cetera. And then we want to have community-based organizations help sign people up for appointment slots. So that's going to be the next phase of vaccination once we get more supply. Ultimately, what we want to do is we want to continue these partnerships. These small clinics appear to be very helpful, and they appear to be ones that where our community-based organization partners have been very successful in talking to people about the vaccine. People are just, especially elders in the community, have become natural vaccine ambassadors. And so these folks have been helping talk to people about getting vaccinated, and so we anticipate continuing with these partnerships. We eventually also want to move forward with mass vaccination events. So these are events that can serve up to 1,000 or 2,000 people over the course of 2 to 3 days, maybe at a place like Lumen Field or at another large space, and then have people cycle through. And again, we would reserve a certain amount of those slots for community-based organizations so they can help sign up their elders and their older adults who may have language access issues and other limitations in signing up for appointments. We also eventually want to transform our COVID-19 testing sites, of which if any of you have received a COVID-19 testing site, they're in places like Garfield Community Center, they're down in Rainier Beach, they're at community centers and parks across Seattle. We also want to transform those sites into not just testing centers, but also places where people can go and get vaccinated. But all this can only happen when we have the supply. And right now the supply is really low. And then regarding outreach, we're doing also, one of the things that I really am a big fan of are media outlets that publish or broadcast in languages other than English to a specific community that is an immigrant or refugee community. Shorthand, I use the term ethnic media. It's not the best term, but Seattle has an amazing ecosystem of ethnic media outlets, from Univision to Seattle Chinese Post to Runta. So these news sources are very important sources of information for communities where it's low, their people are low English proficient. So we want to make sure we're working with them to translate press releases or to make sure that they have access to the latest information, translated information about COVID-19 and vaccination clinics, so that they can communicate to individuals who are probably not reading the Seattle Times. They're definitely not reading The Stranger or the Seattle Weekly, but they are reading or watching or listening to El Rey or La Raza del Noroeste, et cetera. And we want to make sure that they have the most accurate information so that people know where to go and know what the public health recommendations are. Another example is that we learned that the Archdiocese of Seattle was holding a vaccination event at Holy Family at White Center, and they didn't know how to get a hold of Univision. So I tried to make sure that Pablo Gaviria made his way there so he could get some good film of Reverend Eusebio Elizondo and the pastor of Holy Family getting their vaccinations, talking about how the Pope himself has endorsed the vaccines, and that especially folks who are Catholic should not be concerned that the church is against the vaccine, because the church absolutely supports the vaccine. So we really try to work with our ethnic media partners and also work with community-based organizations to make sure that there's accurate information out there in limited English proficient communities. Also, I just wanted to mention that similar to what Becky mentioned with the state hotline, the City of Seattle has our customer service bureau. You can call that number 206-684-CITY, CITY, or 684-2489. And those operators are able to also help explain to you about what clinics are coming up or what the city's doing around COVID-19 vaccines. And if you are limited English proficient or an English language learner, you can call the number and request for an over-the-phone interpreter, and then someone can interpret for you if you need that type of assistance. And then to answer some of the comments in the chat, yes, so we're setting up the vaccines in neighborhoods that are based on kind of a twofold. Right now, some people know that Public Health Seattle King County is really pushing vaccines for folks who are 75 years of age or older. So we are also recommending that our community-based organizations recruit their clients and their community members in that age group. Sometimes they have folks who are not quite there, but are still eligible under the state requirements. The Seattle Fire Department will not turn people away. If you show up and your name matches the name on the appointment, you will get vaccinated. And again, as Becky mentioned, it's free of charge. You will still get vaccinated regardless of your ability to pay or whether or not you have insurance. And when do you think we'll have adequate supply for everyone? Unsure. Right now, I have heard there are news stories out that the federal government has substantially doubled their supply, which is still good news, but still not enough. So we hope and anticipate that supply will be increased substantially by the spring. But for now, we are guessing that it'll still be, at least for the city, for us as a vaccine provider, 1,000 per week. Now, other vaccine providers are receiving more. Some vaccine providers are getting 1,000 a week like us. Some are getting 20,000. It just depends on what kind of vaccine provider you are. Of course, the hospital systems are getting more vaccine than, say, a community clinic. And of course, like the city of Seattle, we're also only getting that much as well, if we get that even at all. Also, I just want to point out that, as probably folks know, much of the United States is under severe winter weather right now. That has also unfortunately created havoc with receiving vaccine. It turns out that we may be getting less vaccine because some of the supply is being held up by impacts from the severe winter weather affecting the US. And then questions about and then so if folks are part of a community-based organization and you're interested in helping recruit, you can contact me. I'll leave my information here, my email and my phone number. Definitely contact me, and I'm happy to chat with you more about, oops, I sent that accidentally to just one person. I'll send it to all of you, and and you can email or you can call me, and we can figure that out. But again, we have a waiting list and vaccine supply is low, so it's going to take a while until we can get to folks who are able to organize their own small mobile clinics, or get to the point where we can have more and more community-based organizations fill up time slots at larger vaccine events. I've probably talked way too much, but any questions or anything else that folks need me to talk about?
I think we can have Becky address questions from the chat and then also from the Q&A. Becky, do you want to start addressing those from the document?
Yeah, I was actually just typing into the chat. I love when I turn my camera on. I'm like, what did my bangs just do? I was currently typing into the chat the current languages we have. But again, currently we have 15 languages. I'm happy to read them all off, or I can put them in the chat, or I can email it out to folks. And we are having more created as we speak. And then I just wanted to echo a lot of what Joaquin said. Yeah, we did not receive some of the shipment we were supposed to get based on all the snow and horrible weather happening, which is just one more delay in getting the vaccines. And it's been super, super frustrating for a lot of folks. Yeah, so there are questions in the chat, and then there's also the Q&A you sent me.
Jessica also with OIRA has been, and also Jose. So Jessica has been monitoring questions. I think Jessica can just read the question out loud, and then Becky, you can answer. How does that sound?
Okay, and then again, Joaquin, if some of these questions belong to you, please feel free to answer. And I did answer one of the questions actually in the chat about so but go ahead.
All right, go ahead, Jessica.
Sure. So one of the first questions asked was, is it 2 doses for all types of vaccines?
So it is 2 doses specifically for the ones that are here in the U.S. So for the that are approved here in the U.S. So for the Pfizer and the Moderna vaccine. I will say, you know, folks have been hearing a lot about the Johnson & Johnson vaccine. That vaccine is going to be 1 dose. It's not showing to be as effective as the Moderna and Pfizer vaccine. So then one of the things I keep hearing from people is like, then why do it? Why would we ever do it? And so I really want to recognize what a game changer a 1-dose vaccine will be, especially when you think not just here in the US, but globally, and how difficult it is to get folks back even with one shot, let alone 2. So it's still effective, although not as effective, and it will be 1 dose. And will probably be approved here in the US shortly, which is why I wanted to make sure to mention that. But currently the 2 approved, Pfizer and Moderna, are both 2 shots, 2 doses. Long answer to a very simple question. So hopefully that was helpful, though, to explain the Johnson & Johnson one that's coming down the pike.
The next question asked is, if someone has antibody for COVID-19, how does the vaccine help them? Do they need the vaccine?
Awesome. And I did address this, so I apologize if it's a little redundant, but I think it's important for people to know that, yes, after having, you know, like what we talk about as a natural COVID infection, but after getting COVID and having that infection, we do believe that there's some immunity to the infection, so people will have some antibodies created. You know, we have seen people get COVID more than once, and so, you know, we're not exactly sure all of the factors involved in how much immunity, and is it, you know, we're thinking it's probably 6 months, but we're still at this point talking about 3 months because we have more data on that. So the answer is that, yeah, it's still important for folks to get the vaccine, especially again, if they're eligible for a vaccine right now. That means they're in a group that is pretty high risk of getting COVID. And because we're in such limited demand, it's up to them to decide, you know, do you want to do it today or do you want to wait? The only downside would be that you may have, I shouldn't say the only downside, but the thing to expect would be that you may have some more, you may feel the side effects more because you already have some antibodies created. That said, with such limited supply, it's hard to think about someone who is in one of these priority groups turning down a vaccine today. So that's up to them to decide, how they want to do it. And, some folks are like, I'm not leaving the house anyway, so I'll just wait. And other folks are like, yeah, I know I'll have some more side effects, and that's okay. I'm going to go ahead and do it. So that's how it'll impact folks who've already had it.
Within that same question, is there anyone that should not take the vaccine?
Anyone who should not take the vaccine, is that what you said?
Yes.
So, I've gotten a lot of questions about, many health conditions, and I've gotten a lot of questions about, if someone has cancer and they're doing radiation, or if somebody is on this medication or that medication. And, if anyone is ever concerned, I would say talk to your healthcare provider and find out. They are currently including folks in the study who not only have some like underlying health conditions, but they're including folks now who also have like a weakened immune system or immune compromise. So including like folks with HIV are now being included in the studies. And so we're learning about that and how that impacts, their bodies and the immune system. We're not hearing anything negative at this point. And if we did if something was severe, they would stop the research on or with folks. I keep saying on with folks who have these underlying health conditions. But so far, we have not heard that. And again, if anyone's concerned, I would check with your healthcare provider and because you and that person will know all the specifics. The only other folks I would say would be children under 16 can't get it currently.
And then, is there any possibility for a iatrogenic reaction to the vaccination?
I am going to be quite honest and say I don't know what that reaction is. I'm wondering so I'm gonna.
Okay, great. We could follow up with that question.
Yeah, yeah.
And then, how long does the vaccine last? And will we be required to get a booster shot each year?
So again, that is one of the things that we don't know. So I try to be really transparent. Obviously, I just said, I don't know what that word is. I try to be really transparent about what we know and what we don't know. And, one of the things we don't know is how long the immunity will last yet. In the same way that we don't know how long the immunity will last from a natural infection as well. So we may need to get them yearly, like flu vaccines. We may need to get them every, other year. We're just not sure yet. And as we continue to learn that information will, we'll continue to provide that information out in the community.
Great, thanks. Another question from a panelist is, can you clarify sterilizing immunity? I saw this statement from a frontline health professional recently stating that unlike many traditional vaccines, the design of these novel vaccines does not generate what is known to be sterilizing immunity. Instead, they prime your immune system to recognize one of the viral proteins, which will then theoretically help you better fight off the virus if you encounter it.
Yeah, I guess I'm not quite sure what the question is asking, and it sounds like maybe they have a specific answer that they are want to share with the group. So I'm happy if you want to share it and paste it into the chat. I also did paste some more information about and a clarification about the material in the vaccine as well. So I posted that in the chat because there was a question, I think pretty similar. So basically the mRNA molecule it creates a protein on cells and trains our bodies to that looks like or mimics COVID. And so it trains our immune system and our response system to detect that protein or detect COVID when it enters the body. So it's training the cell, our antibodies to seek that out and to recognize it. So I'm not sure if that's what the question is asking, and if they have a specific thing they want to share, they're welcome to.
Lenny clarified his question, which is, what is sterilizing immunity, if you're able to answer that? And how is it different from new vaccines provided?
Yeah, and I'm not able to answer that.
Okay, thanks. And then another question, I know you mentioned that not enough research has been done on children and only folks 16 and up were included in the studies. Are there any cases of children being affected by COVID-19?
Oh yeah, absolutely. I mean, we're still learning the effects of COVID-19 on people's bodies in general, and especially children. So yeah, children can get COVID-19, the infection, and COVID, and they can pass COVID-19 to other folks, and they can get sick from COVID-19. I mean, we've definitely seen young people get less impacted and less illness from it, but that doesn't mean there haven't been cases of severe illness amongst children. So, you know, the research is going to continue to figure out if it's safe for children, and once it's decided if it's safe and effective for children, then then it will be approved for children as well. So the answer is yes, absolutely. Children are impacted by the virus. And I will say too, I can't say one webinar that I've done that I haven't at least not known the answer to at least one question. So I apologize for not knowing everything about it, and and hopefully you know, we can get back to you with answers.
Thanks. Another question is, does not having any or reduced side effects after getting vaccinated mean that you're not as immune or protected?
You know, that's a great question, because especially since I said, like, oh, this is very normal. It's also very normal for folks to not have the side effects. We definitely see a full range. It's just that, you know, one of the hard parts is we talk about them as side effects, but they're really just a normal response to getting a vaccine. And when we talk about it as side effects, it seems like this unusual thing. And so, no, if someone gets a vaccine and they don't have those effects, they're still having the same response. I mean, again, the research shows that with the 2 doses, they're 95% protected. And I want to be clear too, the 2 doses, and then someone needs to also not get COVID for the next 2 weeks. So it's not like the antibodies just create overnight. It does take a couple of weeks for our body to produce enough of those antibodies that they're protected up to that 95%. So I do want to make sure to say that as well. But thank you for clarifying that. That's a really important thing to know, that people are still protected whether or not they have those side effects.
So we know that if someone gets COVID-19, that they can potentially get it again. If you do get it again, can you continue to be a carrier and make others around you sick and get COVID-19?
Yeah, so if someone has a COVID-19 infection and they heal, and then they get another COVID-19 infection, they get COVID-19 from somebody else again, absolutely, they can pass it. It's not like they're going to carry it forever in their body, but as they have that infection, they can still pass it. And so that's when, if someone is exposed to somebody with COVID-19, they still do want to go ahead and quarantine and isolate. The CDC has just released, and you know, we're still actually reviewing this information, but the CDC just announced that someone has been vaccinated, it's been more than 2 weeks since their last dose, that if someone is in contact with somebody with COVID-19, they don't have to isolate, and we're still kind of reviewing that information at the county and what our messaging is around that. Does that answer the question? I
hope so.
Okay. If it didn't, please go ahead and put it back in the chat.
And then some of these questions are either for you, Becky, or for Joaquin. So the next one is, when someone calls Washington Base Finder, how do they get proof of qualification to take the vaccine appointment?
So my understanding of the proof of that is they're not asking for proof of so when they enter the information on Base Finder, it'll ask them all the questions, but they're not entering proof. I know that there have been some facilities and hospitals where they've asked to supply like a letter from an employer, and Base Finder is not. It's on the honor system as far as I've heard and understand it to be. Joaquin, do you want to add anything around that?
No, I think you got it. Also, I was just answering a question that someone had emailed me, so I kind of missed the question. What was the question again? I just assumed you got it because, you know, you're you and you're amazing.
The question was about having to have proof of being in the eligibility. And so, for example, at the county's community vaccine sites or the mass vaccine clinics, you might have heard them called, we ask people to bring ID, but if someone doesn't have ID and they don't bring it, then they are still going to get their vaccine. And so, you know, even though it's a certain age and up, we're not, again, it's still, there's some level of honor system to it. And Face Finder is the same thing. You enter your information and you don't have to supply like a letter or anything. But again, that said, I've definitely heard of some like private facilities asking for some proof. So you may hear some mixed messaging on that.
Yeah, as yeah, Becky's right. And what a lot of folks have experienced is that because there's no centralized way to sign up for the vaccine, and because there's no one-stop shop place where you can find out who has what vaccine when, it really has been a challenge to have to go through all these different websites and all these different phone numbers to figure out, does this site have vaccine supply? Does my provider have vaccine supply? And then how am I able to sign up and not get shut out of getting a appointment? So some places are requesting a screenshot of the final screen at the end of the Phase Finder online form that says you qualify, and then you may have to either take a picture of it or take a screenshot and bring that with you. On the City of Seattle side, we're pretty low barrier, so we don't ask for any of that. All we ask is an ID so that we make sure that the name on your ID matches the name on the appointment, and then you get vaccinated as long as you're eligible. And again, as I think Becky mentioned earlier, it doesn't matter your citizenship status or immigration status. It doesn't matter your ability to pay. You are able to access a vaccine at most any of our clinics between King County and Seattle.
Thank you. So I'm going to clump two questions together. When do you think that we'll have adequate supply for everyone? And is setting vaccines in neighborhood contingent on whether they are in the correct phase due to Governor Inslee's guidelines?
I heard well, no, I forgot the first one. The second question, you cut out a little bit, so I didn't hear that. The first question, I'm sorry, can you read that again?
Of course.
My apologies. I'm on hour 12, so I'm trying to track the questions. Sorry, go ahead. Can you read that first, just the first question again?
Sure. When do you think that we'll have adequate supply for everyone?
Right. Awesome. You know, I'm always a little hesitant to give dates because things are changing rapidly. I mean, again, you know, the federal government buying 200 million doses is a game changer. But our hope is that by the end of summer, that most folks, and again, most isn't 100%, but by the end of summer, most folks who want to be vaccinated and are able to be vaccinated, meaning they're over 16, that they will have been vaccinated. That's the hope. So that's not 100%, but that's our hope. Great. And then what was the second part? I'm sorry. And Joaquin, I'm sorry. Did you want to add anything to that?
No, yeah, just that things have been very unpredictable when it comes to vaccine supply, even more so now with the winter weather. But things are looking hopeful in terms of the news we're getting from the federal government. So we share in King County's optimism that the summer will have a pretty robust supply.
Thanks. And the second part of the question was, with setting up vaccines in neighborhoods, is it contingent on whether they are in the correct phase due to Governor Inslee's guidelines?
So I think I'm still a little unclear on the question, but yeah, so I think I'm a little unclear of the question still. Joaquin?
I think the question is conflating the reopening phases with the eligibility phases, is my guess. Basically, the answer is no. The only thing that's restricting vaccine availability in neighborhoods is supply. If we had a hugely robust supply, there would be vaccine community events in neighborhoods across the city. But because of supply, that's just not where we're at, unfortunately. I know that the city of Seattle is prioritizing Rainier Beach and Rainier Valley because that's where the inequities have been consistent in terms of infection rates and deaths. So that is something that we're working with our immigrant and refugee community-based organizations to organize these clinics. But really, it comes down to supply. When we have enough supply, we do anticipate more vaccination events.
Yeah, and I will definitely echo that. You know, for King County, we have the 2 community vaccine sites in Kent and Auburn that are doing 500 vaccines a day. And the reason is when you look at, again, disproportionate allocation of vaccine and who's getting it, and also who's being more impacted, meaning who's dying at higher rates, who's getting seriously ill at higher rates. South King County really needed the vaccine and these mass vaccine clinics in order to be more equitable in the distribution. So, and the other thing that I know Joaquin mentioned that the city is doing, that the county is also doing, is we have a whole plan of not just, you come to us, but that we go to you as well. So we have a plan for many different ways of getting the vaccine out in the community, including, mobile clinics. The firefighters have been trained and are doing it in Bellevue and doing it in South King County and doing it, meaning vaccinating people, sorry. Also, and going to people who can't go to them. And so we, the hope is that when we have enough vaccine, there will be many, many different ways to get it, including at your, the local community agency that you go to all the time, or the pharmacy you go to all the time, or having a mobile unit come to you if you're not able to go to them. So yeah, I agree with that, Joaquin, that these are the holdup is the actual vaccine availability. We have a plan, we're ready. We just need the vaccine. Yeah.
And to Kate's question in the chat, yes, undocumented people can get vaccinated. Really, the issue is we're not asking for people's citizenship status. So, someone's immigration or citizenship status is not really an issue. We're just asking for an ID. And again, whether or not you have insurance or whether or not you can pay, that doesn't matter. We just want to get as many people vaccinated as possible to reach population immunity.
Yeah, and that's the same for the county. And for us too, if someone doesn't have ID or they show up without it, it's fine. We don't need it. And the same is true. Folks can get it regardless of citizenship and regardless of money. If people have insurance, they can use their insurance to get it. Sometimes the copays are too high, right? And so they don't have to use their insurance to get it through the county, and our hope is to get everybody vaccinated who can get vaccinated if they choose to. Someone asked too, and I'm sorry if we're going out of order, Jessica, but someone also asked if you have to do the same brand for the first dose and second dose, and the answer is yes. The ways that the study worked is, Moderna only studied Moderna and Pfizer only studied Pfizer, so that's what we know. And also the way that you'll know which dose you got is, you actually get like a card after your dose that says, the date you got it, which one you got, and that way you'll know which one you got. I'm definitely recommending for folks to take a picture of that card, so you also, so you'll have it. I know for me, I lose cards, so if you can take a picture of it. But the big key is also don't post that on social media. We've definitely seen folks post their card, and sometimes it has their next appointment, and then someone else will go and get their vaccine. So you don't want to post it on social media, even if you love all your friends on there. But you do want to take a picture so you'll know which one you got and what the date was that you got it. And then hopefully you'll have a date for your second shot when you get the first one. And if they're not offering you that, I would advocate for yourself at that point. Like, can I make an appointment for my second dose?
But with that same question, if there is a shortage of doses and someone gets their first dose, what is the effectiveness, and do you think that there is a possibility that people will be vaccinated for their first dose but won't be able to have their second dose? How is the city managing that?
So, well, I will say there is a shortage. Like we're in it, and so they're actually reserving the second doses for people before giving that. They're the same medication, but they're not giving the reserved doses to people as a first dose because they're reserving these for the second dose, if that makes sense. And so, you know, I'm going to say hopefully not, because what we haven't seen that happen yet. And what we've seen happen is people are, that we've been reserving the doses for the second shot. After, again, for the ones that we have here in the US, Moderna and Pfizer, after the first shot, people are about 50% protected, and the second shot would be about 95% protected. And so that you can see that's why we do want people to get the second dose. If someone's late for their second dose, like we just had this, you know, major snowstorm for Seattle. So if someone's late, that's okay. They just want to go and get it as soon as possible. You know, the studies were very precise, so I can't tell you exactly what would happen if you're like 2 weeks late, or, you know, because we don't know, we didn't study that, but we do know with the vaccines in general, you do want to be as close to the timeline as you can.
Thank you. The next question is, there are so many news media sites and secondary sources covering COVID-19 vaccination, events, and eligibility. It can become very confusing. What are the best and most direct sources to follow and learn about vaccination events and eligibility?
So I actually put two in the chat. If you search for me, you'll see I put, Joaquin, you'll probably want to put the city one in there. So I put the link for the county, and that is where, like, the most up to date, both about the vaccine here in the county, and I mean, we're constantly scrubbing out old information and putting in new information, just constant. And then I also put the state like location finder for vaccines as well. And then I would definitely recommend, like taking what you hear on the news with a grain of salt, and definitely recommend, I mentioned our website in terms of for information. I would also recommend the Center for Disease Control for information, and then also the World Health Organization. But in order to find your closest vaccine location, I put those in the chat as well. And Joaquin, do you want to put the city one in there too? Oh, thank you.
And I believe you answered this question earlier, but to reconfirm, should a mother with that is breastfeeding receive the vaccination?
That's a great question, and I'm always happy to re-answer it because I think it's important. So we have, so the vaccine did not have people who were breastfeeding or chest feeding in the study. And so they did not research it on safety for lactation or breast milk or chest milk. Or the same thing is true, they did not, there were no people who were pregnant in the study. And that said, it has been approved for folks, and so who are breastfeeding or chest feeding, and for folks who are pregnant, and we have not heard any, you know, adverse or any bad things happening around the pregnancy or the milk. And that said, it's up to the person to decide, you know, what they're comfortable with for their body. They may want to chat with their healthcare provider, and then also weigh it against the risk of getting COVID, and how risky it is that they might get the infection as well. So it is approved, and folks can get it, and they then just want to make that decision for themselves, how comfortable they feel. I do want to add that we have not seen anything that tells us it's not okay for someone who's breastfeeding or chest feeding or pregnant, and yeah, and that we have no reason to think that it wouldn't be safe.
And a clarifying questions from the attendees. So we know that the vaccine is 95% effective to protect you from getting COVID infection, but it's not clear if it will protect you from spreading COVID, and not sure how long the vaccine will last at this moment. Is that correct?
That is correct. That is correct. And
And
that's
then-
why we're continuing to, even after someone's vaccinated, we continue to stress washing hands, wearing a face covering or mask, not touching your face, cleaning high touch surfaces like doorknobs and railings, so things like that. So continuing to be super diligent about all of the prevention that we've been doing for the last year.
And then another question from an attendee, a curious question. Is it dangerous if someone gets vaccinated twice?
We haven't studied it. So, I'm assuming that means 4 doses, or doing maybe one vaccine and then the other. I will say, it's similar, like we don't recommend someone, like if they have a headache, you don't go take ibuprofen and Tylenol, and then, whatever the other pain relievers are, because it's just, you don't need it, right? This is 95% effective. We don't need it. I don't know if it's damaging. I would guess people would have higher side effects because, again, you already have the antibodies. But, again, we haven't researched if someone gets 3 doses or 4 doses. We also know that it's not necessary to do.
And then is there a concern about people who have asthma getting the vaccination?
There is not a concern about that, no. And again, I'm going to look up and see if that was one of the I know that they definitely, it was studied for folks with lung disease, which I understand is different than asthma. But so, folks who definitely had some illness in their lungs were part of the vaccine studies. So that leads me to think that, asthma would also be something that would be fine as well. And again, if people are ever concerned, they want to check. Sorry, I'm looking for this one thing I want to pull up. They want to check with their healthcare providers. And I'm actually going to pull up a document that was created. So Fred Hutch here locally were some of the folks who were part of the Moderna vaccine trials, and they oversaw a global vaccine, 5 networks of global vaccines, and they actually created this handout. So this will show you the sort of breakdown of who was in the studies, including ages, underlying health conditions, race and ethnicity. And so lung disease was part of that, and I don't know if that included asthma or not. It would lead me to believe though that that there isn't a reason to be concerned about it. And I'll just leave this up here for a minute. And again, Fred Hutch was part of the Moderna study, and you can see, I do want to point out that Fred Hutch has had, basically they've had these HIV vaccine networks for years, and they do amazing community engagement and work in communities, and have been for years through the HIV vaccine studies. And so when COVID happened, they sort of pivoted and turned into temporarily or have been doing the COVID vaccine. So they were able to be really inclusive in their study based on the trust that they had in community and with community. Okay, that said, I'll stop talking now and wait for the next question.
The next question is, do you think the vaccine will continue to be free once population immunity has been achieved? For example, if the antibodies are good for 1 year, in 2022, would we need to get the vaccine and have to pay for it?
And again, that I don't know what will happen in the future. I know that public health is committed to providing this vaccine for free. I haven't heard of any of that changing in a year or not. It seems pretty to be a major factor in preventing a pandemic in the future. And public health already provides vaccines, either free or low cost. And one of the things to say about our clinics is that, you know, if folks ever have a charge and they can't pay it, they just don't pay it. So, you know, and we've always worked with community or invite community who are, you know, not U.S. citizens, invite community who don't have insurance. And so this is just part of the work we do.
Thanks. Another question. So we know that people can get COVID-19 more than once. Do you know the percentage exactly, Becky?
I don't know, and it's something that we're still learning. And so, yeah, I mean, yeah, there's been different numbers and different research around that. And so, yeah, I'm just going to say I don't know because it's something we're still learning. Especially considering we have seen people, again, we do think there's some immunity, probably up to 6 months, but we've also seen people get COVID again in that 6 months. So that, you know, that's concerning.
And then we have also seen that at the end of a vaccine day, anyone can walk up to a vaccine clinic to receive a vaccination if they don't have an appointment. What's the accurate messaging for this?
So the accurate messaging, and again, Joaquin, I will let you speak for the city. I will speak for the county and say that we work really hard to not have any doses left at the end of the day. The reason why those doses, if there's any left over at the end of the day, they have to get into somebody's arm, is otherwise they need to be destroyed. So when they're taken off of, when they're thawed, when they're taken off of ice and they're thawed, they have to be used within a certain amount of time, or they have to be destroyed and they can't be used. So the way that that we do it, and I believe the city does the same thing, is we have appointments, but we also have a list of folks who are on the next appointments. And so if someone doesn't show up for their appointment, we go down the list and make phone calls and try to fill all of the appointments for the day. And then we also only thaw the numbers that we're planning on using. So it is, I know that was all over the news, and I know that that was a concern. It's definitely something that we have taken really seriously, and we really try to prevent there being any leftover doses at the end of the day. That said, if there are doses at the end of the day, then they do need to get into someone's arm so they don't get destroyed. And so I've definitely seen different facilities do that in different ways of really trying to still hit target folks who are eligible. So like older folks who are essential employees. Yeah, but the goal is to not have any extra doses at the end of the day. Joaquin, do you want to address that too?
Yeah, we share in public health Seattle King County strategy of making sure that there's wait lists, and for all of our clinics, there's at least 10 people on a wait list because we anticipate that some people won't make their appointments. And in that strategy, we, I think to date, have been able to use 100% of our vaccines. And according to the most recent stats, 70% of those went to people who are BIPOC, Black, Indigenous people of color. So it is the strategy, especially partnering with community-based organizations, has been very effective. And now it's just a matter of getting more supplies so we can continue moving forward with vaccine our most vulnerable immigrant and refugee elders and residents.
A follow-up question with that would be, would there be times where people who are able to walk in and get leftover doses have a difficult time receiving a second dose because essentially they didn't qualify for the first dose?
So, I mean, for our clinics, we don't recommend ever folks just walking into any of our sites for a vaccine. We don't take walk-ins for a site. I know that, again, that's been something that's been a lot on the news of, you know, folks doing that, and that's not a strategy that we utilize. And then again, if somebody gets a first vaccine, we do make them an appointment at our clinics. We make them an appointment for the second vaccine because it is hard to get through on the lines. And again, because there's such limited supply, there are long waits on hold, and it can be difficult to make them and frustrating to make appointments. So we are giving folks the appointment for their second dose when they come in for their first dose.
Yeah, same with the city of Seattle. We don't take walk-ins. They are currently by appointment only, and when someone does get their first dose, they are immediately scheduled for their second dose. And that's usually at a clinic that is also organized between Seattle Fire Department and the host community-based organization ahead of time.
And then I think right now we have 2 more questions. Is if a person is in their 50s and do not live in a multi-generational household, when do you think that they would be eligible to receive the vaccine?
I'm sorry, can you repeat that question?
Sure. If a person is in their 50s and do not live in a multi-generational household, when do you think they will be eligible to receive vaccination? Do you think it will be sooner or later?
I can put in the chat there is, I mean, again, I put the link to the phase finder, and so that would be the most active. Again, there's different circumstances. If someone has underlying health conditions, if they don't, if they're an essential employee, if they're not. So it's more than just age. And so if you again scroll through the chat, and I can put it in again, the phase finder, when people can go in and find when they are eligible. And then there's also, actually that's going to be the best tool for folks to use, as long, again, as they speak English or Spanish and read English or Spanish. And then otherwise, I had mentioned that phone number earlier, so I'll put the phone number in the chat. Joaquin, did you want to say anything different about that?
Yeah, just that according to the Department of Health at the state level, phase 1B tier 2 is when folks who are 50 years of older and who work in certain settings like in agriculture or food production, that's when they're set to be able to get vaccinated. As to, you know, when we can move to that, it depends on, again, supply. And I know, I'm sorry I sound like a broken record because I keep saying supply, 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 but that really is the most significant step that's affecting the availability of vaccine. So if we get enough supply, then soon. If supply continues to be low, then it'll get pushed out much later in terms of access and eligibility.
And there's some questions about who is eligible now. So actually what I'm gonna do is just grab that off of our website. Sorry, I actually have it I'm just gonna grab it and put it into the chat so that folks can have, because it is a little, you know, there's a lot to it. There's not a lot to it. There's just a few things to know. So I will put that into the chat so everyone can see it. And to be clear, sorry, I was talking about who is eligible to get vaccinated now.
Another question would be, what do we make of the relatively lower infection rate and cases in King County and Washington overall compared to the nation? I believe that we saw that we're doing a bit better than before.
Joaquin, do you want to take that or do you want me to?
Go for it. This is one of those guest questions, I think, right?
Yeah, I mean, I think we've been doing a great job. I mean, you know, it's interesting when I hear, I don't think we've been perfect, and I think it's a pandemic and we've been learning and muddling through, right? But I do think that, and I think that we have really taken it seriously and mandated, you know, a lot of the prevention methods. And you know, one of the best questions, I did a podcast with some teenagers, and they were great. And then one of the questions they asked me was like, well, what do you see as just the worst case scenario? And I was like, I think we're here. Like, I mean, we have shut down our economy, and this was at the time when I said that we are at the highest rate. It was like, everything was still closed. We hadn't moved to phase 2. We, and I was like, we've shut down the economy. Before this last shutdown, over 35% of small businesses in King County had closed. It's been devastating. And I do think that Washington State, we saw we were some of the first hit. I mean, I remember my family on the East Coast was like, what are you talking about? What are you doing? I'm like, oh, this is nothing. It's just a flu, no big deal. And we were, we were having devastating effects from COVID. So I think we were the first hit, one of the first hit. And I also think we had a really, even though like a very difficult response, I think that our local governments and health departments have really tried hard to have very strong prevention. So, and I say that with all acknowledgement of the devastation of both economy, individuals, hunger, folks experiencing homelessness, like all of it has been devastating on top of it.
Yeah, I would just say part of our effectiveness is the great work at our friends at Public Health Seattle King County. So thank you.
The next question is, do we know, or how many people have received the vaccine in the city, county, and state as of today?
Yeah, we actually, you can get that on our website. I will pull it up right now. I was supposed to put something else in the chat that I haven't done yet, but I will. But the King County Public Health Seattle King County, I just reversed our own name, website has we have different dashboards. So if you just Google King County COVID, dashboard, they'll come up, or even just King County COVID, you'll find that. And so we have dashboards on our site, and I'm going to actually just show you them real quick, hopefully that's okay for folks. And you can find all of that data. We've been really stressing transparency of numbers, both on like who and where COVID outbreaks are happening and who's getting it and who's being hardest hit, and then also in terms of vaccine. So when I've been invited to come present for specific communities, I will actually go to this dashboard. I will pull up our latest numbers. You can see them here, and then you can also do it by demographics. You can also look at geography and look up your city and or look up the geography. Let me see. I'm gonna see if I can do this while I'm on here. And then you can see, by region, who has been vaccinated, like the numbers of folks who've gotten 1 dose and 2 dose. So all of this is on our dashboard, is what we call it. And I'll put that in the chat. So that didn't give you the actual numbers, but you can find it where I'm sending you.
Another question is, someone told me they tested positive after getting the vaccine. What's the appropriate response for that?
Yeah, so again, the vaccines aren't 100% effective, and they do take, each shot takes about 2 weeks before the antibodies have been created. The first vaccine, I keep hearing about it happening, especially after the first vaccine. And it's good to remember the first vaccine, people are only about 50% protected. And then the second vaccine is 95%, but again, they have to wait those 2 weeks. And really, again, what we know is it prevents people from being, having serious illness and death. And then we're still learning whether or not people can get a COVID infection with the vaccine. I'm going to stop scrolling and trying to find what I'm finding while I'm talking to you.
I have another question. Has there been any movement in centralizing appointment locators to one location rather than or movement to share scheduling when vaccine appointments are being released? For example, in Florida, an appointment site announced that folks could try and book on every Wednesday and Friday at 7 a.m. Was that clear enough?
Yeah, I mean, I can speak to the, on our end that we, one of the links that I gave was for the, I'm pointing, sorry, to the chat, was to the Face Finder. I mean, that's really one of the biggest places to find like a statewide that you can find your location and then I'll find out if you're eligible. And then in terms of finding a site, I mean, we are working in the city, and obviously you can see right here that the city and the county are working closely together to try to also, continue to get information out in simplified ways, so that and have it in location. The problem is that some people go to the city and some people go to, their city in Bellevue and or in Renton, and then some people come to the county. So we also are trying to have it on many places as well. And then the pop-up clinics that Joaquin mentioned and I mentioned, they are community specific. So they, the pop-up clinics are not ones you would go to our site and sign up for. They're ones that, that we're partnering with community agencies who work in and with communities who are being disproportionately impacted by COVID. And that way we're really trying to get into community and get the vaccine to communities who need it the most. So our website that I posted the link in for the county is the site for us where folks can go and find out, the information as we know it. We also try to put out press releases. We let, the news media know. We're on Facebook. We have all Twitter, Instagram. We have all of our social media. So we really try to get the information out far and wide. The problem is we don't have the vaccine to open up a phone line that says call this day and this day and you can get your appointments, because we opened up these mass vaccine sites through the end of February, and the appointments filled in 2 days. We just don't have the vaccine to meet all of the need, and that is devastating, but true. Joaquin, do you want to
add? Yeah, no, that you answered it. Also, I was typing up an answer to a question in the chat. So, yeah, go Becky.
And I know you guys said that pop-up vaccine sites are contingent on the supply that we have, and they are directed to certain demographics. When there is more vaccine available, will there be more pop-up sites kind of directing to a more broader demographic?
I can speak to that. Yeah, our goal is to make this as, when we have the vaccine, to make it as available as possible. And so for some folks, they're going to need a pop-up. They need a clinic in their community, and maybe they don't have access to driving or or being able to get somewhere. And for some folks, they can go to their local pharmacy. So for us, the goal is to have as many modes as possible available in community for folks to get the vaccine. So, some communities aren't going to need a pop-up clinic because they're going to have their pharmacy right there, and other communities are going to need a pop-up clinic. So we're really trying to, again, get it out as far as possible when we have the vaccine. And then again, some folks are going to need those mobile units to go to them. So it just depends on the community and access that they have. And again, we're really trying to make sure that access is equitable. And by equitable, I mean that the people who need it get it. And the folks who are being highly impacted are able to get it.
Great, thank you.
And I did put it in the chat. Sorry, I'm sorry, Jessica, for cutting you off. I did put in the chat who is eligible, because there were a lot of questions I saw about who can get it and when can you get it. I'm sorry, who can get it right now. And so I did put that in the chat, and then I'm also going to put the link to learn more about our distribution plans as well. I'm sorry, the state distribution plans as well.
Perfect, thank you. A follow-up question to the dashboard you provided. An attendee asks, I frequently look at the county's dashboard. The reporting on a daily basis can be impacted by different variables, but the 7-day average seems to be more reliable to check what's going on. It looks like our rates are similar to last spring. How can we make sense of that? More testing now or more spreading now?
You know, and I would have to look at that to answer that question. What I can say is actually that our testing, we've seen a reduction in testing. So I do, you know, that's a good reminder for me to stress that people still want to get tested for whatever reason. After the new year, we've definitely seen a reduction in people getting tested. And our rates are definitely headed in the right direction. We are, meaning they've been getting better. We moved to phase 2 because they were getting better, but we also moved to phase 2 because the restrictions eased up, and we sort of barely eked by to move to phase 2. So, you know, I say that because I want to make sure that folks don't get complacent, that, you know, the governor's plan at this point is to assess every 2 weeks. The numbers were before it was every week, and the part of that is because we now do have vaccine and people are getting vaccinated, and because the numbers were getting better, but we're also concerned about where things are going to, if things are going to shift based on these new, more contagious strains. So again, I'd have to look at the numbers and the comparisons. For a long time, until just very recently, we had seen numbers of deaths going up, hospitalizations going up, hospital beds being filled, and infections going up, and only in the recent several weeks have we seen that, you know, start to actually go in the right direction and be getting better. So yeah, we're just concerned about the new strains for sure.
Great, thank you. I believe those are the questions for now. If anybody does have any other questions, feel free to type it in the chat box and we will get those answered.
Yeah, I'm looking through the chat box now that I'm not talking to see if we miss any. Do folks have questions too about prevention or about any of the general information? I know we only have, we have 2 minutes. So we have 2 minutes, but you know, I do want to make sure that that folks get their information.
Oh, great. There's one more question. If someone gets sick and hospitalized because of COVID at this time, does the vaccine help them?
You know, I don't know that someone would get the vaccine while they are sick with COVID, because again, at this point, their body's already creating antibodies to fight it. So, and then you'd be adding in a vaccine that would then also create the antibodies that your body's already creating to fight it. So, so I don't know if I know the exact answer to that one, but I would imagine that someone would not get the vaccine while they have an active infection, and that's definitely something that, you know, I can look up and verify. But just based on what we know about it, it doesn't seem like the way that it would go.
Would you recommend an individual to get tested for COVID-19 before their vaccination?
Oh, you know, if someone's having symptoms, yes. But if someone's not we don't require someone to get a COVID test before they get vaccinated. But if someone thinks they might have an active infection, then they would want to get a COVID test, because again, that would not be the time, at least in my understanding, that would not be the time that they would get the vaccine. But no, we do not require people or necessarily even recommend for them to get tested if they're not having symptoms before they get the vaccine.
And then another question about eligibility. What if you are over 50, and a part-time caregiver or someone like a parent who cannot live alone? Would you fall in the 1BQ category? My understanding is that you would all have to be living in the same place.
for the same housing. So it depends on, again, like some of these depend on the situation, which is why I don't ever just say like yes or no without knowing more information. But they would have to be living in that multi-generational household together.
I believe those are all the questions for now.
I really appreciate, the city for inviting me. So, and the Office of Immigrant and Refugee Affairs for inviting me to partner with them on this call. I'm super excited that we got to do this. I think this would be a good time to also mention the one that's happening in Spanish. Oh, go ahead, Peggy.
Yeah, thank you, Becky, so much. That's just round of applause. Really appreciate your time, and then like you still keep it so energetic for the crowd. So we have another session scheduled on February 25th. It's a session that will happen in that will be conducted in Spanish. So everything will be in Spanish. If you have if you're interested in it and you understand the language, or you would like to share the information with others, we will put it in the chat with more event information. And again, this PowerPoint and then the recording will be shared via email to everybody who participated and who've received the invite through your email. We will also post a recording on our social media, so you can share that as well. And again, thank you so much, Becky and Joaquin and Jessica and Jose, everybody for supporting and attending the session. Thank you so much.
And I put my email in the chat. I do have a couple of other some folks who weren't able to attend this, so there's at least 2 more similar events that are going to be occurring. And so if you know folks who wanted to attend this and couldn't, I could invite them into one of those events as well. Those ones are not in partnership with the city, but I'd be happy to invite them in if Joaquin or Peggy would want to come. You'd be welcome. All right, well, thank you all so much. Appreciate everybody being here.
Thank you, everyone.
Thank you, everyone.
Thank you.
Hey, Peggy, if you could,